I'm Dr. Virgie Bright Ellington, and on today's episode of What Your Medical Debt Doctor Wants You to Know, we're going to talk about a big contributor to the $1 trillion in medical debt in the United States. So people know or probably heard medical bills are the number one cause of debt and bankruptcy in this country. But there's actually $1 trillion in medical bills that are out there. And here's one of the things you need to know about the cause of the $1 trillion of medical bills so it doesn't happen to you. Nonprofit hospitals, which are 65% of all the hospitals in the United States, are estimated to contribute up to 30% of the $1 trillion American medical debt crisis by not providing sliding scale financial assistance to patients that they've agreed to cover and provide in exchange for tax exempt status. So I'm really excited to talk about this with someone I just think is just absolutely genius. He's come up with a genius idea that's really going to save families. He's going to save families. I really believe that not only is it going to save families, it's going to save lives, one medical bill at a time. Nick McLaughlin is the founder and CEO of Breez Health. Breez Health makes financial assistance easy for patients and hospitals. So what he did was connect patients who are low income in the communities of nonprofit hospitals with the hospital's financial assistance programs. So the Breez, easy breezy, I guess, easy peasy. We'll have to ask Nick where the name for Breez, for the software and the company came from. But I think it's because it really makes things easy, helping hospitals connect their patients with their financial assistance programs, kind of like TurboTax for financial assistance programs for non-profit hospitals. So Nick, tell me, did I get that right?
Yeah, you did great, Dr. Virgie. Absolutely. It's a pleasure to be on with you today. And you're right about the origin of the name. The mission has always been financial assistance made easy. We say we make financial assistance a breeze because that's a huge part of it. And so it's a pleasure.
Awesome. Thanks again so much for being here. So I have to tell you, I was kind of stunned when I ran across what you do. I think I was going through LinkedIn or something, and they were talking about the financial assistance programs not covering the patients in nonprofit hospitals and communities that they should. And I'm trying to remember how I ran across your work, and reading through it, and it hit me. I'm like, oh my gosh, this is genius. So what you're doing is creating software so that every person who comes through a nonprofit medical facilities, comes through their doors, is automatically screened for their financial assistance programs. And the reason why this is important is because there's a lot of data, studies and statistics that show that up to 30% of the outstanding medical debt, meaning medical bills that have gone to collections and are registered with credit agencies, 30% of that number those patients have never heard of charity care, financial aid, or financial assistance programs with the non-profit hospitals from care that they received. That's a huge number of folks that should have gotten either a tiny bill or no bill at all, who never heard of charity care or financial assistance or financial aid. That's why what you're doing is genius and so critical and needed. And if you can tell us a little bit about, how did Breez happen? How did you get here? Tell us about your genius background, Nick.
It's hardly a genius background, Dr. Vergy, but you are highlighting a problem that became very apparent to me in my last life, my last career. And quite frankly, I mean, in college, I took a job working for a revenue cycle management company. What I didn't know when I got a job as a patient financial counselor at a revenue cycle management company was that meant I was a collector talking to patients about past due hospital bills. So my job was working in the hospital billing and collections agency, and I spent about 12 years in that space, partnering with hospitals and working with patients to collect past due hospital bills. And what was interesting about that is, I mean, my mom's a nurse. My dad's a PhD environmental scientist. They both about disowned me when they heard that I was working for a collections agency. But doing that work with a patient-friendly approach was important to me. However, even the most effective collection agencies out there are only recovering 5, 10, maybe a little bit more than that percent of the accounts that their hospital clients send to them. And so from my perspective, my question was, I wonder why so many of these accounts don't have the ability to pay. Why are hospitals sending us balances that hospitals can't afford to pay? And the next question that popped into my head was, I wonder what percentage of these patients would have qualified for financial assistance according to the hospital's financial assistance policy. And just real quick, for those out there, nonprofit hospitals have financial assistance policies, and in those policies, there are income eligibility guidelines. So the hospital says in their policy who qualifies for these discounts, and the discounts are often up to 100% of the patient balance. So even if you have insurance, a lot of patients qualify for financial assistance. And so the question was, how many of these patients would have qualified that are coming into our office? And it turns out that the number is more than half. More than half of the accounts that most hospitals are sending to collections would have qualified for financial assistance or charity care based upon the hospital's policy. It's just that those policies weren't working. And so, again, why? Like, why would that be the case? And a handful of years ago, I was at a family gathering with my in-laws on my wife's side of the family. Her grandpa was there, and he had just spent 4 days in the hospital, and he came up to me and said, Nick, I know you're in the hospital billing world. I've got a bill here for $750 that I really can't afford to pay. What should I do? Is there anything out there for me? And I mean, Grandma and Grandpa, they were on Social Security, didn't have retirement savings, had the condo that they lived in, but still had a mortgage on their condo, in their mid 80s. I mean, just no extra resources. And I said, well, Grandpa, have you ever thought about or looked into financial assistance? And Dr. Vergy, what do you think his response to that was?
What? What's that?
What's that? Exactly. He had no idea what it is. And that was the beginning of me getting a really close understanding of how financial assistance programs, like how the patient experience with financial assistance programs feels from the patient's perspective.
Ignorance is not bliss. And the system really depends on the American public, the American patient, not knowing what their rights are and what the responsibilities are of the medical facilities and medical care system that provides care to them. Yeah, that is the issue. So I'm curious, Nick, going back to when you were brought on to this company of revenue cycle management, essentially, a fancy name for making sure we get paid, collecting our outstanding bills and invoices. What kind of training did they give you as a newbie, fresh out of school, your first, real job, kind of wet behind the, what they call it, wet behind the ears? What kind of training did you get from this company, this bill collection, debt collection company?
Well, it's funny you say fresh out of school. I was actually still in school. It was a part-time job.
Wow.
but HIPAA training around privacy and security and trying to make sure we're protecting patient health information, so that there aren't data breaches, and privacy is very important in that space. But really just some how to talk to patients. And I was on the phone with patients within a week and a half, 2 weeks of training. And then it's just kind of figure it out from there. So it's safe to say that I didn't have a very strong understanding of medical financial literacy myself when I was supposed to be in a spot of helping patients understand their own financial obligations in the medical bill space.
Was this debt collection company a company that focused just on medical bills, or was that just medical bills just a piece of
just hospitals and health systems?
So the only training you get from this medical bill debt collection company is HIPAA training. So Health Insurance Portability and Accountability Act training, meaning privacy and keeping health information and personal identifying data private.
A little bit of how to talk to patients, a little bit of how to read a hospital bill, but mostly just here are the scripts you need to know. Lean on them, and you'll be all right.
So they give you the HIPAA training and how to talk to folks, how to schmooze folks, and then how to lean on them, scripts to how to schmooze, and then how to lean on them to try to get the bill paid. That was your training,
more or less,
essentially, in a nutshell. So then how did you come to find out that nonprofit facilities, and I have to be honest with you, I don't call them nonprofit anymore. I call them nonprofit to the public, but they're just tax exempt facilities because they do get revenue. They're not called profit because they're not a for-profit system, but best believe they're stashing away revenue. So there's a huge difference between the revenues that they take in and what they pay out, their expenses. And the difference is in a for-profit company would be called profit. In a nonprofit facility, it's called, or let me back up, tax exempt facility is called, I think, net revenues. Okay. So how did you find out that, hey, nonprofit facilities have a requirement by law, by federal law, in exchange for tax exempt status to provide sliding scale up to complete financial assistance, aid, or charity care, depending on what you want to call it, for those in their community, in the community in which they serve? How did you figure that out? How did you find out about that?
The rollout of the Affordable Care Act had a significant piece to play there. Medicaid expansion had a role in that. So helping more of the lowest income patients get on the Medicaid program so that hospitals can get paid even a little bit for those services. But what was really fascinating being in the collection space was called 501R, and it's a federal law that essentially lays a framework for how hospitals are to have written financial assistance policies, how they are to offer them to patients, publicize them to patients, and essentially the framework of what's supposed to be included in those. And since, especially in the last few years, state governments have been ramping up what is included and what is required in financial assistance programs, what income levels must require or must qualify for free care or discounted care, what assets can be considered for in a determination, what information can be asked for. The state of New York has a law in session right now that they say hospitals, you may not consider immigration status when it comes to whether or not a patient is eligible for financial assistance, and that's a point that is common among a number of these laws. Illinois has one, California, Oregon, places like that. So strengthening the laws behind that, and in the collections world, that impacted a lot of the accounts that came to us, because the folks that don't have the ability to pay, nobody wins with those situations. Like when Medicaid expanded, it reduced the volume of accounts that went to collections, but the volume that it reduced were the ones that couldn't afford to pay anyhow. And so that's really what inspired the desire to lean into financial assistance was the reality that, okay, the folks that are lower in the income spectrum, and when I say lower, well, let me be a little bit more clear about that. Most hospitals offer partial discounts to patients up to 400% of the federal poverty level. Nobody knows what the federal poverty level is offhand. It's a sliding scale based upon family size, but let me put it this way. Imagine there is an elderly couple on a fixed income like my grandparents. They could be receiving up to $73,000 a year in Social Security benefits and retirement income and still qualify for financial assistance. If we expand that to, let's say we've got a family of 5, mom, dad, 3 kids, 400% of the federal poverty level for that family is about $130,000 a year in household income. So lower income doesn't mean $20 an hour and below. Like these are families that are kind of low to low mid income ranges. And a lot of the folks that I've spoken to, especially those that are working and have a hard time with their hospital bills, what they don't know is that they actually do qualify for significant discounts on their hospital and health system bills. And I just plead that those folks reach out to their hospitals and say, hey, can you send me a financial assistance application? What we do with our clients is help make the hospital's financial assistance application easy to access and navigate and complete and do it all online. Most hospitals have a pretty clunky, burdensome paper-based process where they'll mail patients out an application form and ask you to fill out all this information and figure out from a list of documents what proof of income or assets or residency that you need to complete and send in. It's kind of a headache. So what we do is streamline that process and make it easier for patients and easier to manage on the hospital side. So if your hospital is not yet a partner with Breez and you can't complete your application online, feel free to send them our way. Let them know Nick would love to talk to them from Breez. But yeah, it's about streamlining that process. And definitely Google your hospital name and financial assistance, and it'll get you to those documents. And I mean, it's probably not going to be the easiest process, but you very well may save thousands and thousands of dollars on your hospital bills. And let me tell you one more personal story. My sister and brother-in-law were in their early 20s, found out they were having a baby, and my sister was working at an entry-level job in the city. My brother-in-law was finishing school, and their baby bills for the new baby was going to be significantly more than they can afford. They had a $5,000 deductible, and and my sister called me up and said, "Hey, so is this one of those financial assistance situations?" And so I helped walk them through the financial assistance application process, and it turns out they qualified for an 80% discount on their hospital bills, which brought that balance from $5,000 down to $1,000, which is still a lot of money, but a huge relief. It's a lot easier to put a $1,000 hospital bill on a payment plan than $5,000 and hope maybe you'll get it taken care of by 3-4 years from now.
All right, 5 years down the road if we're fortunate.
Right.
Yeah, I was also surprised, like you, Nick, that if you have a 6-figure income, you can still qualify for sliding scale relief depending on how big the bill is. Sometimes you have a big bill and the bill is such that compared to your income, it doesn't matter if you're well into the 6 figures, the bill may be big enough that you qualify according to the sliding scale regulations. So that's huge. When I found out, folks getting I think 100, I think it was before tax, their annual salary is $150,000 a year. And for this particular nonprofit institution, bill was, I want to say about $10,000. And the person called them up and said, this is my situation, what can I do? And in this particular situation, without asking, they were sent a paper application in snail mail to fill out their financial assistance information. So the thing is that, if you don't ask, you won't get, right? But
Right.
the problem is, Nick, and why we're here is that most folks don't know that they need to know. We don't know what we don't know. And the system takes advantage of that. That's how, we end up with, this country ends up with $1 trillion in medical bills out there.
Can I make 2 points on that real quick?
Please.
I agree that you don't know what you don't know, and broader community awareness of the availability of financial assistance programs is extremely important. But it's also important that we destigmatize these programs, because
yes.
a lot of folks are like, oh, but I don't get, I'm too proud to apply for this. And what these programs really are simply income-based discount programs that allows hospitals to make care affordable for the folks that need the help. So like my recommendation to everyone out there is, unless you're making $200,000-$300,000 a year plus, fill out a financial assistance application at your hospital or health system every year. Just do it, because there's a significant chance that you'll qualify. And if you need care, you're not going to be terrified to go to the hospital next time something pops up, because you know that they've got your back. And that's one of the main purposes for these nonprofit hospital organizations. Almost everyone in their mission or values will echo the statement, we are here to care for our patients regardless of their ability to pay. And the mechanism that allows hospitals to do that and to partner with their communities in that way is their financial assistance policy. That's the means to protecting access to care, that is outside of financial counselors making sure that they're able to collect all of the appropriate insurance information, or helping patients navigate the financial assist or the Medicaid application process, or health insurance marketplace. And so it's important to hospitals as well to help patients maintain affordable access to care, because it's a way that they can truly lean into the nonprofit mission that they have. It's just the way we've gotten to where we are is a lot of automated rules and not a whole lot of focus on the availability of financial assistance and how it actually works. And so now's the time to see if you qualify for financial assistance, complete your applications, go through those processes, because it's like backup insurance on your health insurance, even if you have it.
I just can't tell you how profound that is, Nick. Perfectly said. I really, really love, and I'm writing it down, and I'm going to incorporate that into one of my catchphrases. So tax exempt facilities, medical care facilities, AKA nonprofit hospitals. When you go to a hospital, find out, determine, just do a quick Google search, is it nonprofit or not, meaning tax exempt. And by definition, tax exempt / nonprofit medical facilities, by definition, provide income-based discounts. Boom.
Well,
no statements saying it's not a program, it's not charity care, it's not financial aid, it's not financial assistance. It is just a straightforward income-based discount, as by IRS federal law to be determined tax exempt status. They have to give that back to the community that they serve.
And most for-profit hospitals do as well. The three biggest for-profit health systems in the country also require their hospitals to offer financial assistance to patients, because they want to be good community citizens as well. So even if it's not a nonprofit hospital, the policies are going to be a little bit less generous from an income benchmark perspective, but they're still there, and it's still important to see if you qualify and complete an application.
That's huge, Nick. I mentioned that in my book, Crush Medical Debt, what your doctor wants you to know to crush medical debt, that always ask, even for-profit facilities have some kind of financial assistance programs. And I said, I'm not going to use that term again. Even for-profit facilities, medical care facilities, have income-based discounts. So I really appreciate you bringing that up, that they're not as generous, and maybe they're not required by law, but they do exist. And it's great PR for them, frankly. None of these facilities want to end up on social media or in, traditional, nightly local news, or even, sometimes national news, because of, egregious bills that their patient cannot, or patients, plural, cannot afford.
Right.
Really important. The other thing I want you to, or I'm appreciative that you just brought up, is that, and I'm not surprised that you know these numbers, but a lot of people don't know these numbers. The more we owe in medical bills, the less likely we are to receive care. And it's gotten to the point that it is starting to affect the average American's health and wellness status. So let's say that you have type 2 diabetes, and you had an issue where you had to be hospitalized for a period of time, and you've got your medications that now you have to take. You're kind of not taking them before, okay, but oh great, now I know this is serious, let me take my meds. You've got this big bill, and I can't handle this bill. I'm doing the best I can, but you know what, to save money, I'm not going to go back. I know the doc said I should come back in 3 months. I'll get back to them when I can. And in the meantime, I'm just going to take my pills every other day to save money. That is the reality. That's what we're looking at. That's what we're dealing with. So when I say, I know, Nick, you say that I am being very generous by saying that you guys are saving lives, that, this is brilliant. And what you guys do actually save lives is true. You're saving lives, you're saving families, one medical bill at a time. This is good stuff, Nick. Thank you for what you do.
We are staunch patient advocates, but in our experience, we've also seen really good intentions from hospitals and health systems. I know they get a bad rap for being the genesis of the problem that exists, but like I said, we see a lot of really good intentions and positive action and desire towards making these programs more widely available to the patients that qualify. And I mean, if you ask hospitals, okay, so you've got your policy, and according to your policy, you've got the patients that qualify for financial assistance. Right now, most of those patients are going to collections because they can't afford to pay. Would you prefer if those patients that qualify get on your financial assistance program? And the answer is yes. Every time the answer is yes. And so that's why we partner with hospitals as patient advocates, using a technology solution to make it easier for patients to access and navigate financial assistance.
So where can patients find you, Nick?
So learn more about what we're doing at Breez Health. Our website's probably the best spot. It's BreezHealth.com. So there's only 2 E's in the word Breez, at least the way we do it. So BreezHealth.com is going to be your best spot. Breez Financial Assistance made easy. All of these will get you to us and our stuff.
Good stuff. Good stuff. Thank you so much, Nick. I really appreciate you taking the time to educate us and talking to us about, how to make sure that if we get care at a nonprofit facility, and maybe even a for-profit facility, that we advocate for ourselves and get income-based discounts on every bill we receive. Awesome stuff. Good stuff.
Absolutely.
Thank you so much. You take good care, Nick.
My pleasure, Dr. Virgie. Thank you so much.